Welcome to Cryptic Accounts, a podcast by paranoid people for paranoid people. And this week on the show, we've got Theranos and Elizabeth Holmes. I'm Patrick Ryan, joined as always by Dennis Chaney. Hi, Dennis.
Hello, Patrick. I'm looking forward to this. We got a corporate conspiracy.
Yeah, this is going to be a little bit kind of different sort of episode than what we normally do. Like, we're going back to the elf waves and mind control and all that. I just needed a breather and needed just a little something different to look into here for a bit, because that is just, it's a lot. All that stuff's a lot. There's more of it coming, though. I figured this has been something you and me have talked about kind of outside the show as something that we would like to get into a little bit more, which is like corporate conspiracies.
Oh, yeah, totally.
I think this is going to be a good one to kind of kick things off with.
Yeah, I'm aware of this lady. I've seen some stuff about her, but it looks like you did a really deep dive, so I'm pretty interested to hear the whole story.
Oh man, I read, I think pretty much everything that's been written about this company and this lady. Like, I've read a lot about this company, and then it was hard trying to compact, much like the Karen Silkwood episode. There was just so much information about it because it was a corporate thing that it was hard to kind of boil it down. So, but I am definitely, I feel like I have a plethora of knowledge about this topic now. Probably too much for any one person, really. Before we get into all that, though, thank you all so much for tuning in. Whether you're listening or watching, we appreciate it. Go ahead and hit the like, rate, subscribe button for us. If you're a returning listener, watcher, and you're enjoying the show, why don't you share it with somebody? Send your favorite episode to a friend and get them hooked on this too. We really appreciate it. We see all that stuff. It helps us grow, and yeah, you're awesome, and we love you for it. So with that, are you ready to get into some Theranos and Elizabeth Holmes, Dennis?
I am ready.
All right, let's get into this. So, one afternoon in early September 2014, Elizabeth Holmes took the stage at TEDMed, which is the TED Talks like medical division, like conferences or whatever. And this was held at the Palace of Fine Arts in San Francisco. She went there to talk about blood. TEDMed, a part of the Technology, Entertainment, and Design Enterprise, is an annual conference devoted to healthcare. Its speakers span a range of inquiry from Craig Venter, the genomic scientist, discussing synthetic life, to Ozzy Osbourne discussing his decision to get his entire genome sequenced. It's a wide range of contributors.
Are you telling me that somewhere online there's Ozzy Osbourne giving a TED Talk?
I think so, yes. I mean, I would assume it's televised somewhere.
Yeah, are there subtitles? Because I can't imagine sitting through like 20 minutes of Ozzy Osbourne talking.
Yeah, when they sequenced the like vocal part of his brain, like it was just very blurry. They didn't get a lot of information out of it, is what I heard.
Okay.
So it's a place, the TEDMed conferences, a place where the phrase disruptive technology and the future of medicine comes up a lot. At this point, Holmes is 30 years old. Holmes told the audience that blood testing can be done more quickly, conveniently, and inexpensively, and that lives can be saved as a consequence, which is a weird way to phrase that. It's a consequence of this faster thing. Consequence, I always think of a bad thing when I hear the word consequence. It's weird that's what she chose to say, but she did. Now, she was wearing her daily uniform, a black suit and black cotton turtleneck, reminiscent of Steve Jobs, and had her hair pinned back in an unruly bun. And I'll put up a picture of her. Like, this is how she dressed pretty much all the time. Like, anything you look up about her, about 90% of the photos are her in this outfit with this turtleneck looking like Steve Jobs.
Yeah.
And as she spoke, she even kind of used his mannerism. She paced slowly, her eyes rarely blinking, and her hands clasped at her waist. Now, Holmes was the CEO of a company called Theranos, a Silicon Valley company that was working to upend the lucrative business of blood testing. Blood analysis is integral to medicine. When your physician wants to check some aspect of your health, such as your cholesterol or glucose levels, or look for indications of kidney or liver problems, a blood test is often required. This typically involves a long needle and several blood-filled vials, as I'm sure most people are aware. It's then sent off to a lab for analysis. Altogether, diagnostic lab testing, including testing done by the two dominant lab companies, Quest and Laboratory Corporations of America, generate over $75 billion a year in revenue.
Man, I just gave blood 2 weeks ago, and I forgot how much they take. It is kind of
all of it. They take all the blood.
Yeah.
So Holmes started Theranos back in 2003, so 11 years prior to when she's at TEDMed. At this point, she's 19 years old. She dropped out of Stanford the following year. Since then, she told the audience, the company had developed blood tests that can help detect dozens of medical conditions from high cholesterol to cancer based on simply a drop or two of blood drawn with a pinprick from your finger. So no more of the big vials like I've got behind me. Just this little bit on the other side if you're watching on YouTube. Just a tiny little pinprick on your finger. And she's saying she can do all that stuff with it.
That's the story.
Yep. She stated that Theranos was working to make its testing available to several hospital systems, and is in advanced discussions with the Cleveland Clinic. It also opened, and at this point in 2014, it had also opened centers in 41 Walgreens pharmacies with plans to open thousands more. It was simple. If you show up and you show the pharmacist your ID, your insurance card, and a doctor's note, you can have your blood drawn right there. The sample is then sent to a Theranos lab. From that one sample, Holmes said, several tests can be run, all less expensive than standard blood tests, sometimes as much as 90% below the rates that Medicare sets. Which already, that's like Medicare definitely tries to rein in costs to a certain extent. Like they set, we'll pay this much for certain things.
Oh yeah, this would revolutionize
yes.
Testing. Yeah.
Well, it would have wiped out the competitors for sure.
Oh yeah, for sure.
A typical lab test for cholesterol can cost $50 or more. The Theranos test at Walgreens cost only $2.99.
Because it doesn't work.
Oh, I don't know. It's not rush to judgment here, Dennis.
Okay.
Holmes spoke in a near whisper. On stage, her voice drops an octave and takes on a formal instructional cadence.
It's creepy. Did you watch videos of her?
We're going to get into, I have one of most of the commercials have been scrubbed from the internet, but there is one from this series that she did that's her talking about Theranos and the blood testing. And yes, I guess if you didn't know she was faking, you would just think she had a weird voice. But yeah, she's like talking very, very low like this. Like,
I know.
But is like a very petite blonde. At this point in the commercial, she would have been about 30 years old. But she looks like she's all of about 20 years old. Like she looks super young.
Yeah. And there is video of her real voice.
Yeah, there is some out there. I didn't put any of that in there. I got the one clip of her in the low voice, and it's weird.
It's a weird thing to do for years and years.
Well, I don't know if I get into it or not. I kind of think maybe she kind of thought that being a woman in this position, that she would be more respected possibly if she had a lower voice like a man.
Yeah, but
I don't know if I actually noted that in here, but there were some journalists that were kind of like speculated on this, like
until people find out you're basically walking around going, "Hello, my name is Elizabeth." Like,
yeah, and at different points she kind of slips up. Like there's different points during this whole run that different people talk about her, like, and then she started talking, and it's like she forgot to do her voice.
So sociopathic.
A little bit. So the TEDMed crowd listened intently as she spelled out what she sees as the shortcomings of existing blood testing business. The tests are too costly, are available at inconvenient times and places, and involve unpleasant syringes. Holmes has an aversion to needles, and her mother and her grandmother fainted at the sight of them and at the sight of blood. Quote, I really believe that if we were from a foreign planet and we were sitting here and said, okay, let's brainstorm on torture experiments, the concept of sticking needles into somebody and sucking blood out slowly while the person watches probably qualifies. Holmes told that to a reporter at one point.
Oh, it's not that bad, Elizabeth.
It's torture, Dennis. It's torture.
It's torture.
Holmes said that getting a blood test should instead be a wonderful experience. And the aim of Theranos is to lower the barriers. She told the crowd that between 40 and 60% of people who are ordered by their doctor to get a blood test don't do it. That number seems really high. Doesn't it seem
Yeah,
a
that's
little
like
high?
half the
Oh,
people.
yeah, half the people that get told to take a blood test are like, nope, I'm out. I might have some sort of something, I might, have diabetes. I just can't do it though. Might have high
Yeah.
cholesterol. Not worth finding out.
How afraid of needles would you have to be? I mean, shoot.
Well, I mean, if you're like Elizabeth, you and her family, her mother and her grandmother, you may pass out.
That's like half of people.
Yeah, apparently half of people are that mortified. Which I know people that don't enjoy giving blood. It's like a stressful thing for them. But
Well,
like,
it's not like fun. It's not like going to the movies, but it's not that. I mean, it's like
yeah, it's not quite going to the movies. It's
it
close
feels like
though.
a pinprick. It's a needle. It's designed to not hurt that much. Now, if they were like using a straw, okay, like maybe then I probably wouldn't want to do it. But
Well, I don't know. I don't know where all these people are getting their blood taken. So maybe they might be. So like she said, 40 to 60% don't get the blood test their doctors order. And so diabetes, sexually transmitted diseases, and other common medical conditions could be diagnosed and treated earlier if the test were less onerous and more accessible. She went on to say, we see a world in which no one ever has to say, if only I had known sooner, a world in which no one ever has to say goodbye too soon.
I know it's so. It really would be that way, though. Imagine if you could get like a cancer test at
At home, yeah.
Walgreens, like, oh my gosh, the prevention or like heart disease, like
And
it.
we could do it, Dennis. That's not the way they want it to work, though. That make us possibly too healthy. We know about things too soon. Then we'd be, preventing stuff, and we
That's
wouldn't
true.
die as quick.
We don't want to prevent things. We want to treat it after it happens.
Yes. Yeah. So the board of her company was stocked with prominent former government officials, including George P. Schultz, Henry Kissinger, Sam Nunn, and William H. Foage, who is the former director of the Center for Disease Control and Prevention. Also, Dr. Delos M. Cosgrove, the CEO and president of the Cleveland Clinic. He's an avid supporter. He said at one point, I think it's potentially a breakthrough company. It represents a major change in how we deliver healthcare.
And it would be.
Yes, it would. Yes. Using something they called, so that Theranos called nanotainers, which is a small device designed to draw, retain, and analyze a droplet of blood from a patient's fingertip, and its proprietary Edison testing technology, Theranos claimed the device could run a multitude of tests on a patient's physiology within minutes and at a fraction of the cost of current technology. So, let's kind of back up a little. So, like I said, 2003, 19-year-old, Elizabeth is 19 years old, and she's a Stanford chemical and electrical engineer dropout. Elizabeth Holmes then founded the company a year before she dropped out, like I said, for this revolutionizing blood test. Theranos claimed to have developed blood tests that required only a small amount of blood and devices that could quickly perform the test. Based largely on just those claims, Theranos reportedly raised roughly $724 million of capital from venture capitalists and private investors over the next
Sheesh.
decade. So from 2003 to 2013, almost $1 billion gets raised
Oh my gosh.
for this idea. Now, in hindsight, it's easy enough for people to say they would have seen through what Elizabeth Holmes claimed about her company, Theranos, and its ability to disrupt the medical testing industry. But we can't forget that as the young entrepreneur was on the rise, she had a lot of things in her favor: powerful supporters, an idea that sounded like it was great, that was for the greater good, a compelling personal story, and a really good marketing team and advertising team to back those up. So 2004, year after she started the company, Theranos raises $6.9 million in early funding, gaining a $30 million valuation. Jump to 2007, still just, this is all hush hush. The company's valuation hits $197 million after it raised another $43.2 million in early round funding. Jump 3 years later again, 2010, after further rounds of funding, Theranos was valued at $1 billion.
Oh, wow. I can't believe she kept it going this long.
And, well, we're going to get into how she did that. It's because she really kept everything very hush-hush. Like, she just talked a big game, really. And just people believed her based on the people she had in her corner. So in 2013, after a decade of working in the dark, Holmes introduced Theranos to the world via press appearance and an unveiled website. They didn't even have a website up till this point.
Just getting that money.
Yep, just getting that money. 2014, a year later, with over 400 million in funding now, Theranos was valued at nearly $9 billion. Holmes effectively became a multi-billionaire thanks to her 50% stake in the company. Again, they have not released anything at this point. They're just talking about it.
Right.
All of this, just talking about it. This is a
For a
privately
decade.
held company. Yeah. Now, Theranos' first advertisement was a series of mini movies made by an Academy Award-winning documentarian, Enroll Morris. Most of the ads have been scrubbed from YouTube, so I couldn't easily embed them into my notes, but I did find one of the mini movies, these mini movies, in which Elizabeth is talking about Theranos. So let's just take a look at that right now.
What is wrong with modern medicine?
People don't even know that they have a basic human right to be able to get access to information about themselves and their own bodies that can change their lives. Every person should have the ability to get that type of test, because if you understand that early that you're at risk, there's a lot more that you can do about it. And we'd like to see a world in which every person gets access to this type of basic testing, and the types of tests that are done are ones that provide insight into the onset of disease in time to do something about it.
So that is Elizabeth Holmes in the flesh, everybody. So there's the voice I was talking about. She's just crazy-eyed. I mean, there's a lot going on just in that little clip. And that's not even the craziest videos I could find. Just I couldn't find ones that weren't connected in a way that I could grab them. Anyway, you get the idea. And I don't think the ring lights that they had her lit with like helped at all, because she had like those halos on her pupils.
She looks like an android.
A little bit, doesn't she?
It's hard. I mean, it's hard because, like, if she wasn't, like, evil, I mean, I guess it's kind of mean to make fun. But, like...
Well, it's okay to make... It's okay.
Yeah, it's just all so bizarre.
Yeah, in the big scheme of things, it's very bizarre. But it's just part of this con that she's running, this confidence game that she has. Like,
yep.
This is how I talk. Like, I'm not like normal people. So, you might have picked up on it, and if you look into, if you search more and find like some of the actual ads, if you can dig some of them out, they're very few and far to come between. Theranos marketing was modeled on Apple's marketing. After hiring away several top Apple employees to work with her and even adopting Steve Jobs' signature black turtleneck uniform, Holmes also decided to hire Apple's advertising firm, TBWA Chiat Day. Even if you know nothing about advertising, you know that iconic 1984 Super Bowl ad, the Think Different campaign, which is where Apple kicked everything off and really that's where their march began. So jump forward now a little bit to 2016. Then President-elect Donald Trump was nominating retired Marine General James Mattis for Secretary of Defense. But before that, in 2013, Mattis became a board director at Theranos.
Man, she got a lot of big people.
And we're going to get to how she pulled some of that off a little bit later. He said, the strength of the leader's vision in the military is seen as the critical element in that unit's performance. He told this to a 2014 Fortune piece about Holmes. He went on to say, I wanted to be around something again that had that sort of leadership. He is comparing Elizabeth Holmes' leadership to that of like a high-ranking military general.
Wow. I mean, she has to have some leadership qualities to keep this going on so long.
Oh, she's a machine. We're going to get into kind of her habits a little bit later. She is a machine. So, the blood testing startup was billed as a classic industry disruptor, offering a cheaper, more efficient alternative, like I said, to traditional medical tests. And Holmes, whose mother was a congressional committee staffer and whose father worked for government agencies. So, according to the Washington Post, Mattis' relationship with Holmes dated back to 2011, when they met at a Marine memorial event. Mattis was interested in Holmes' technology for use on the battlefield. Holmes reportedly reached out to Mattis in 2012 after a military official flagged Theranos' technology to the FDA. She wanted Mattis to use his authority to dispel any concerns. Mattis then forwarded the email internally, indicating a sense of urgency in moving forward with the technology, but it never took off. Vanity Fair reported that Mattis denied any FDA interference. He said he was, quote, interested in rapidly having the company's technology tested legally and ethically. You know, because he sits on the board, and that would be probably kind of helpful if we could just kind of move this thing along.
Yeah, she got the people she needs to get.
Yep. Now, in 2016, we're going to jump back and forth a little bit just to grab some details there, just for fun. In 2016, it was also reported by the Wall Street Journal that its own Rupert Murdoch had in fact invested $100 million into the company, but he'd never been publicly linked to the company before that point. So he's in at this point too.
Wow.
Riley Bechtel, a chairman of construction giant Bechtel Group, was an investor on board and board member at Theranos. But as part of changes that Theranos announced in 2016, it said Bechtel would retire from the board. So just a bunch of just heavy hitters on this board. Just the whole thing is just powerful people. Theranos, which was privately held, was both a hardware company and a medical company, and for many years it operated with a stealth common to many Silicon Valley startups. Quote, for a long time, I couldn't even tell my wife what I was working on. That's Channing Robertson, who's a chemical engineer professor at Stanford and was the company's first board member. We will get back to Mr. Robertson here in a little bit. So Holmes had been giving similar versions of her TEDmed presentation in talks and interviews around the country. Investors valued the company, like I said, at more than $9 billion. I'm going to say that a lot because it's ridiculous that this company is worth $9 billion at one point, with a B. A B. It was valued like this because it was comparable to the two big diagnostic labs, Quest and the Laboratories of America or whatever. So Holmes owned more than 50%, like I said, and she was profiled in Fortune in the spring of 2014, and subsequently featured in Forbes as the youngest self-made female billionaire in the world. So 2013, 2014, she's killing it. Everybody loves her. Like, they want to interview her. Like, I read some of the things that like Fortune and stuff. Man, they're just like gushing over her. Like, she's just this mastermind that she just came out of nowhere. She's a genius, right up there with so many other big names that we know, Steve Jobs and so on and so forth. So the company's rise came at a time, around 2013, well, up till this point, when consumers were increasingly eager to access their personal data. The plummeting costs of DNA sequencing technology made it possible for companies such as 23andMe to provide individuals with their genetic information directly, rather than through doctors, which empowered customers.
It's amazing that you could test for diabetes and do all that sequencing for 23andMe or Ancestry.com, but you couldn't do other things with less blood.
Yeah.
I get why she had the idea. I wonder if she just thought, if I keep dumping money into this, eventually it'll work out.
The technology will catch up.
Yeah.
I mean, I kind of wonder that too, honestly, because she does very much, like, if you're not picking up on it yet, she really kind of plays this as more of a tech company than a medical company. Like, she acts like where she's at, Silicon Valley, where all these tech startups happen.
Right.
She's treating it like that, not so much a medical company. Kind
Not
of,
like
and
Quest.
yeah, and
Yeah.
she uses that to her advantage to kind of get around a lot of stuff.
Yeah.
So in her talk, back to the TED-Med talk, she said, "My own life's work in building Theranos is to redefine the paradigm of diagnosis away from one in which people have to present with symptoms in order to get access to information about their bodies, to one in which every person, no matter how much money they have or where they live, has access to actionable health information at the time it matters." Now, M. Cosgrove, the CEO and president of the Cleveland Clinic, predicted the blood tests for many common health issues, including high cholesterol and diabetes, will be initiated by patients as well as doctors. He said the CVS's and the Walgreens and the Walmarts of the world are going to be taking a lot of things that currently go to primary care physicians. The impact of that on our industry will be enormous. But unfiltered medical data aren't a pure virtue. In 2013, the U.S. Food and Drug Administration barred 23andMe from disseminating some information out of concern that consumers might misunderstand or misuse it.
That's interesting. I've never heard that.
I hadn't either, and it was really hard not for me to take a hard right turn there into the Food and Drug Administration and what was going on with that. Because, yeah, I'd never heard about that either. The part that's concerned is, what information about me am I going to misuse?
Yeah, that's interesting. I don't know. I'll have to Google that later. That's crazy. I guess maybe certain, like if you have proclivity for certain diseases or something like that, probably.
I mean, I don't understand how you can misuse that, though.
I mean, maybe they just mean
start living every day like it's your last because you find out that you like have a genetic, like a high genetic chance of like some sort of very fatal cancer or something. Like,
or maybe they don't. They just
feel like that
would
just stimulate the economy, though. Like you just about spending money.
Maybe they just don't want. I mean, I get it. Like if you don't want people to basically get that type of information outside of a doctor's office, like because you might not know what to do with it, but yeah, I don't. It's interesting that you could tell a company you cannot tell people this information about themselves.
And maybe there'll be another corporate conspiracy episode at some point, like what happened with that. So, okay, I want to kind of talk about a little bit about Elizabeth's personal life and kind of where she was coming from as she kind of came up to this point where it becomes like a multi-billion-dollar company. Now, before everything really got crazy, back in the 2000s, she at the time had a 2-bedroom condo in Palo Alto, and she lived an austere life. Although she can quote Jane Austen by heart, she no longer devoted time to novels or friends. She didn't date, she didn't own a television, and said she hadn't taken a vacation in 10 years. Her refrigerator was almost empty, as she ate most of her meals at the office. She's a vegan, and several times a day she drank a pulverized concoction of cucumber, parsley, kale, spinach, romaine lettuce, and celery. Growing up, Holmes was in constant motion. Her father, Chris, worked for government agencies, including for much of his career, the U.S. Agency for International Development and the State Department, often traveling abroad, overseeing relief and disease eradication efforts in developing nations. Later, he became the Global Water Coordinator for the USAID.
Wow.
Her mother, Noelle, worked for nearly a decade as a foreign policy and defense aide on Capitol Hill, until Elizabeth and her brother Christian, 2 years younger than her, were born. The family moved several times, which meant there was little opportunity to develop lasting friendships. Holmes described herself as a happy loner, collecting insects and fishing with her father. Quote, "I was definitely not normal," she said. "I was reading Moby Dick from start to finish when I was about 9. I read a ton of books. I still have a notebook with a complete design for a time machine that I designed when I must have been like 7. The wonderful thing about the way I was raised is that no one ever told me that I couldn't do things." Which to the detriment of society, I would argue at this point.
I know. Well, it sounds like she had everything going for
She
her.
really did.
Yeah, she got into Stanford. She like
Oh, we're
awesome
gonna get into.
parents.
She's super smart. She
Oh, I'm
is
sure she
very,
is.
very, very intelligent. So in 1993, when Elizabeth was only 9, again reading Moby Dick, her father took a job in Houston as executive assistant to the CEO of Tenneco, which was then a manufacturing and energy conglomerate. She knew that her father felt guilty for uprooting the family, so she wrote a letter to console him. Quote, "What I really want out of life is to discover something new, something that mankind didn't know was possible to do." Again, she's 9.
Yeah.
She reassured him that Texas suited her because, quote, "it's big on science." Which is, I, I guess.
I mean, it's cute. I don't know. Is that again? It just sounds like she had everything going for her.
Yeah, she really did.
Yeah.
So for several years, going back a little bit further in the 1980s, Chris Holmes, her dad, spent 2 weeks a month in China helping American companies invest in large-scale development projects. This guy is just all over the place doing all kinds of stuff. And I cut out a bunch of stuff. Like, this goes back several generations. Like, this is kind of a powerful family. Like, they were doing lots of stuff.
Thanks, Chris.
And at one point, like, she talks about, I don't think I included, she talks about at one point how, like, her family would point out the members that weren't like heads of companies or like members of like some state department or something, and would talk about how they were like failures in life and how they obviously like didn't develop and how unhappy they must be.
Oh no, the pressure. She probably had such pressure.
Yep. I kind of gathered that a little bit, yeah. So soon after, the family then moved to Houston. Like I said, Elizabeth started studying Mandarin. By the summer following her sophomore year of high school, she was intent on taking summer classes in Mandarin at Stanford. She repeatedly called the admissions office for information, only to be told each time that the program did not enroll high school students. One day, her father recalls, the head of the program became so annoyed that he grabbed the phone from the employee who was talking to Holmes and said, quote, "You've been calling constantly. I just can't take it anymore. I'm going to give you the test right now." He asked questions in Mandarin. She answered fluently, and he accepted her on the spot. She completed 3 years of college Mandarin while still in high school.
Wow.
Yeah. Which is impressive. That's very, very, very impressive.
No kidding.
And right there, that encompasses her whole attitude that she's going to have for the rest of her life.
Right.
Like, she does not take no for an answer. And I think that just that little bit is just those little things form this like person inside of her. I think that's just like, no, if I just say I can do something, I'll do it.
Yeah, exactly.
It'll happen. And then if anybody tells me no, I'll just keep trying until they go, okay, I'll just beat them down with it. So in 2001, which is her senior year of high school, Holmes applied to Stanford, was accepted, and then was named a President's Scholar, which came with a small stipend to select her own research project. Holmes elected to study chemical engineering. She was drawn to the work of Channing Robertson, who I mentioned earlier, the chemical engineer, and at the time, a dean at the engineering school. Robertson, then 71 years old, Holmes' first class with him was a seminar on devices designed to control the release of drugs into the human body. One day, in her freshman year, Robertson said she came to his office to ask if she could work in his lab with the PhD students. He hesitated, but again, she persisted and he gave in. At the end of the spring term, she told him that she planned to spend the summer working at the Genome Institute in Singapore. He warned her that prospective students had to speak Mandarin. Luckily, she does.
Right.
That summer at the Genome Institute, Holmes worked on testing for severe acute respiratory syndrome, also known as SARS. Testing was done in the traditional manner by collecting blood samples with syringes and mucus with nasal swabs. These methods could detect who was infected, but a separate system was needed to dispense medications, and still another system to then monitor the results. Holmes questioned this approach. At Stanford, she had been exploring what had become known as a lab-on-a-chip technology. which allows multiple measurements to be taken away from tiny amounts of liquid on a single microchip. Quote, with the type of engineering work and systems I had been focusing on at Stanford's, it was quite clear that there was much better ways to do it, she said.
Man, I know we got a ways to go, but I'm starting to feel like maybe she's not a psychopath. Maybe she just was like had all this pressure from her family, and I don't know. We'll get to the crimes, I'm sure.
I'm with you on that, though. I do
Yeah.
kind of feel for her in that aspect. Like, I can't imagine what that pressure is like.
She just got like over exuberant with this like lab on a chip idea.
She's just got a motor on her too. Like, she's got a motor. Like,
Yeah.
like very few people have. Like, she just can go and go and go and go and go. So, before returning to Stanford from her summer in Singapore, Holmes conceived of a way to perform multiple tests at once, using the same drop of blood, and to wirelessly deliver the resulting information to a doctor. That summer, she filed a patent for the idea. It was ultimately approved in November of 2007. So once back on campus, she went to see Robertson in his office and announced that she wanted to start a company. Robertson was impressed by the idea, but urged her at least to consider finishing her degree first. Why, she responded. I know what I want to do. Holmes was consumed by the idea of developing a company. Quote, I got to a point where I was enrolled in all these courses and my parents were spending all this money and I wasn't going to any of them, she said. I was doing this full time, and her parents allowed her to take the money that they had set aside for her tuition and use it as seed money for her company. In March 2004, she dropped out of Stanford. A month later, she had incorporated Theranos. The name, if you're wondering what it means, it's a combination of therapy and diagnosis. She persuaded Robertson to spend 1 day a week as a technical advisor to the company and to serve as her first board member. Eventually, he retired from his tenured position and began working at Theranos full-time.
Oh, no.
He's all in now. And again, this dude is early 70s. You will find there's kind of a vein. I don't mean anything by it, but there is a theme. She's very good at convincing much older men with money and prestige to just do whatever she says.
Yeah.
She definitely uses that to her advantage. So Robertson introduced Holmes to several venture capitalists. She insisted that they abide by her terms, which included an understanding that she would retain control and pour the profits back into the company. By December 2004, she had raised $6 million from an assortment of investors. As she and the chemists and the engineers dug deeper, she became convinced that they could accomplish 5 objectives. First, extract blood without syringes. Then, make a diagnosis from a few drops of blood. And then, automate the test to minimize human errors. Fourth, do the test and get the results more quickly. And lastly, do this all more economically. So a key to the company's success was hiring a man that would later become her boyfriend, and I didn't get too bogged down in their personal life, but Sonny Balwani. He's a software engineer in his 40s when he comes on board, and he had met Holmes in Beijing the summer after her senior year of high school. Yeah.
Oh, boy.
Mm-hmm. Again, that older man theme. So at the time, he was getting an MBA from Berkeley. He had worked at Lotus and at Microsoft and had been a successful entrepreneur. And in 2004, he began graduate studies in computer science at Stanford. He and Holmes spoke often, and they shared a belief that software, not just chemistry or biology, mattered. If Theranos was going to be able to analyze a few drops of blood, engineers would have to develop the software to do it. In 2009, Balwani finally joined as COO and president and said, our platform is about automation. We have automated the process from start to finish. So in 2009, he's saying, we figured it out, you guys. We got this thing all going on. But we still need some more money for the next few years. So just keep that money coming. But
Keep it flowing.
We got it going. Everything's good. Everything's good over here. Theranos managed to keep its technology a secret for much of its decade of existence, in part because it occupies a regulatory gray area. Most other diagnostic labs, including Quest and Laboratory Corporation of America, perform blood tests on equipment they buy from outside manufacturers. And this is the key part. Like Siemens, or Siemens, I don't know how you say that. Siemens?
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 Simons? I don't know.
One or the other. And Roush Diagnostics. Before those devices can be sold, though, to a company like Quest or Laboratory Corporation, they must be approved by the FDA, a process that takes their test performance, it makes their test performance more visible to the public. But since Theranos manufactures its own testing equipment, the FDA doesn't need to approve it, Dennis.
Oh, so that's how they did that.
Yep. If you make it, which is the weirdest rule ever, like, okay, so I need equipment to test blood. Well, if you're going to buy it from somebody, we got to make sure it works. Well, what if I just make it? Well, we don't care if you do that. I mean, that's
well,
fine.
I'm sure eventually she'd have to get approval if they wanted to use it on people. But I'm guessing.
No, she's already using it on people.
Oh dear.
Oh yeah.
How does that make any sense?
Well, you're going to find that's where some of the problems kind of started rising from.
Oh my gosh.
But yeah, no, that's the loophole here. That's what I'm explaining to you. Yeah, if you and me can make our own blood testing equipment, and as long as we don't try and sell it to anybody, we can test blood with it.
Wow.
I had no idea. You think there would be more barriers to entry on that? Nope, you just got to have enough money to make the machine.
Okie doke.
So I got some cardboard and some like twine and stuff out in the ground. I'm gonna whip something together, Dennis, and we're gonna start our own blood analyzing division of cryptic accounts.
You know what's sad is someday this will be reality.
Mm-hmm.
And this lady will just be.
Oh, she will be upset.
Just have to watch it happen. Yeah.
Well, we'll talk about where she may be at that point a little bit later.
Right.
So, like I said, since those devices can be sold, like from companies to companies, they got to be approved by the FDA, which again makes them more visible to the public. But again, Theranos doesn't buy any equipment from anybody; they made their own. FDA doesn't need to approve it as long as the company again doesn't sell it. Or here's another weird stipulation, Dennis, or move it out of its labs. I don't know what that means. Like, you can't move it to another location. Like, it has to be built in the place you're going to do it is kind of what that says to me. It was a very weird distinction.
Yeah. Yeah, I don't know. I should know more about that, but I don't.
As long as you don't sell it or possibly move it to another, just move it, period, you're fine. Holmes said that the company had long resisted discussing how its technology works or how it makes money in order to avoid tipping off potential competitors. But again, don't you got a patent for this, Elizabeth? Like, wasn't that the point of the patent?
Yeah, but I'm sure they were trying to improve.
Yeah, I guess that's true. And again, she's playing this more as like a Silicon Valley tech company than a medical company.
Right.
So at this point, around 2013, 2014, the company employed 700 people. And in addition to its headquarters, had a 265,000 square foot facility in Newark, California. All they did was manufacture the blood testing devices.
That were not sold to anyone or...
And that part makes me think maybe they can move it between their own companies. Maybe they can't store it somewhere else. It's unclear because they're making a ton of these machines, though. Which I guess they're hoping at some point to sell. That was the only part that confused me. Like, why are y'all making a bunch of these? Like, but you don't want to tell anybody how they work or let anybody really see it.
Huh.
That part was confusing. It was almost just like it was a way to like put the money towards something. Again, because she wants to reinvest everything. Let's go ahead and make a bunch of them so that when we can move forward with it, they're already made, I guess.
Right.
I don't know. So for many years, it had earned income from large pharmaceutical companies, including Pfizer and GlaxoSmithKline, which used its tests when they're conducting clinical trials on new drugs. Which, how scary is that?
Yeah.
There for several years, Pfizer and GlaxoSmithKline, for example, were using this as like a way to test blood from new drugs that they were giving people.
Oh, man. I wonder what drugs are out right now that were tested using this.
That, I didn't even think about checking into that. That probably would have made this show very upsetting.
Oh, man.
Now I'm just thinking about that. I was like, oh, no.
Yeah.
What have we all taken that went through these machines or got tested with people that went through these machines? Well, you're going to find it may be okay because they had workarounds a little bit. So it also earned revenue from wellness centers that it set up in Walgreens stores, as well as the U.S. military. Although Holmes would not discuss the company's arrangement with the latter. In 2013, Theranos announced a long-term partnership with Walgreens that would have eventually established its wellness centers in most of the 8,200 Walgreens stores across the nation. The Walgreens in Palo Alto had one, which is, again, this is where it's confusing. Like, these machines are, like, out there, kind of, but they're, again, the FDA is not involved. It's very confusing. So the Walgreens in Palo Alto had one, as did 40 Walgreens pharmacies in Phoenix. Holmes envisioned wellness centers in most Walgreens and Duane Reade stores, which would put Theranos within 5 miles of every American. Theranos also could sign up the rival drugstore chain CVS, which has about 7,800 outlets. So well over like 15, 16,000 is her goal, like all over the place. We're all going to be within 5 miles of being able to get Theranos.
Every drugstore.
Which I think what they mean by in the store, actually, now I think about the research and everything, I think it's you can get your blood drawn there, but then it goes off to one of their labs.
To the labs. Yeah, that's what you said earlier.
They are keeping the machines. That explains the FDA thing, is they're in control of the machine.
Right.
But they've got like techs, or they're allowing the little poker that they're using, the nano, oh God, what is it called? Up at the beginning.
Nanometer? I don't know.
Yeah, it was something like that. Sorry. It was a weird name. It's basically just it's a little piece of plastic that's got like a little pinprick on it and sucks a little, just grabs a tiny little bit of blood. So the lab for testing was a large place bustling with chemists and technicians and housing rows of machines. So this is where all the machines are going. Each easy for a single person to lift. So they're not very big. In which the containers of blood are then placed. What exactly happens in the machines was treated as a state secret. And Holmes' description of the process was comically vague, Dennis. I think you're gonna enjoy this. Quote, she said about how the machine worked, a chemistry is performed so that a chemical reaction occurs and generates a signal from the chemical interaction with the sample, which is translated into a result, which is then reviewed by certified laboratory personnel. She went on to add, thanks to miniaturization and automation, we are able to handle these tiny samples. I feel like I know how it works now, don't you, Dennis?
You put it in the box and it does its thing, basically.
She literally could have yelled science and it would have been the same thing.
Yeah. Science!
How do you do this, Elizabeth? Science! So, Theranos really owed its success in part to its high-powered board, which Holmes corralled with the help of George Shultz, a Palo Alto resident who, if you're not aware, in his long career, held 4 cabinet positions, including Secretary of Treasury and the Secretary of State. Shultz was in his 90s and a fellow at Stanford's Hoover Institution. Holmes first met him in 2011. Quote, it was one of those scheduled 10-minute meetings that turned into a 2-hour meeting, she said. Shultz agreed to join the board, and he met with Holmes weekly. He introduced her to several other board members, which included Bill Frist, a trained cardiac surgeon and one of the few medical people that we were going to talk about at all having any involvement in this company, and former Senate Republican Majority Leader Henry Kissinger. The former Secretary of State, Sam Nunn, a former Democratic senator and chairman of the Armed Service Committee, as well as William J. Perry.
I was going to say, Henry Kissinger is the Secretary of State. Bill Frist was the Republican Majority Leader.
Yes, sorry.
Back during Bush.
I read my spacing wrong, my commas and stuff. Yeah. So, okay. And then J. Perry, who was the former Defense Secretary, and Richard Kovacevic, I think, a former CEO and chairman of Wells Fargo. They all received stock options from the company, among other forms of compensation. Kissinger, who also at this point in his 90s, said that Holmes has a sort of ethereal quality. That is to say, she looks like she is 19. And you say to yourself, how is she ever going to run this? She does so, he said, by intellectual dominance. She knows the subject. Kissinger in his 90s right there. That's the prime. That's the prime. So board members were charmed by Holmes. She is a careful listener, and she is unnervingly serene. Employees say they can't remember an instance when she raised her voice. Quote, she has sometimes been called another Steve Jobs, but I think that's an inadequate comparison, Perry, who knew Jobs, said. She has a social consciousness that Steve never had. He was a genius. She's one with a big heart. So
Yeah.
just everybody has bought her whole spiel, just hook, line, and sinker. She's a genius with a heart of gold, Dennis, who just wants to make the world a better place. It's a story we all want, and I think that's really why everybody went along with it. It's what you want.
It's what, you want this like young, go-getter to come out and change the world. It's easy to root for her.
Well, and then you've got a billionaire that's now for the common man, wants to make things better medically for everybody, no matter how much money you have.
Right.
Like, it's the perfect story. Holmes said that she looked for, quote, different kinds of people for her 12-member board, but it was pointed out that the membership included no women. She said, quote, hopefully I qualify. Equally notable is the fact that the 8 of the members are former elected, federal, or military officials. Aside from Frist, the one other board member with a medical license is William Fogey, the former CDC director. Holmes established a medical task force also, chaired by her and Dr. David Helfet, the director of the orthopedic trauma service at New York's Hospital for Special Surgery and New York Presbyterian Hospital. Holmes was asked if the board was designed to attract government contracts. We don't have any government contracts, she said. I've never applied for one, and I don't plan to. That's a lie, though. Theranos later conceded that it does earn revenue, again, like I said earlier, from the military.
Yeah, I was going to say.
Yeah, but she's out lying about it. This is after the fact. Like, she's still just saying they don't get any money. And then Theranos is coming out, like, publicly later, like, the board, I think, is like, you can't just say we're not getting money from them. Like, we got money from them.
Man, this is all building up. This is like a slow-moving train wreck.
Right, isn't it? So, like I said, Theranos conceded that they got money from the military, which Holmes calls a really important area in terms of potential for saving lives. So now she's flipped back around. She's like, but, the military, we got a lot of chances to save lives there. So I guess we are doing it, but it's a good thing that we're doing it.
Right.
But she said that the company's policy was to make its testing available for far less than the government is willing to pay us. Look, they offered us this much money, and we only want this much money, you guys. We want less than what the contract was for. I'm trying to make the world a better place, aren't I?
Everything she says is so likable.
It really is. It's like, if you didn't know everything now, how this kind of turns out, then yeah. So she added that it would be insulting to suggest that her board members function as lobbyists. She viewed them as partners who are helping her to chart strategy. Kovacevic said that he brings business experience to the board. Quote, I know most of the major retail company CEOs, so I'm very helpful in pushing this thing along. That's why I'm here. I got friends. Holmes and her board members liked emphasizing how technologically advanced Theranos was. The implicit comparison is with the existing diagnostic behemoths such as Quest Diagnostics. The blood test business is, quote, dictated by people who make the big machines, Frisch said, and they obviously have a vested interest in keeping their technology out of there. He went on to add, you don't need 4 tubes of blood for a range of tests or this 1940 technology. This is one of the doctors on this thing, too.
Yeah, I'm interested to know what their competitors were doing.
Oh, yeah. That's where we're going next, actually.
Okay, oh, yeah.
Quest Diagnostic actually took issue with several of Theranos' claims. Holmes argued that people want their blood tests to be more convenient. As evident, she often stated that between 40 and 60% of patients who are asked to get blood tests fail to do so. Theranos developed these numbers internally, in part, Holmes said, through consumer surveys.
Oh, she made them up. Okay, that makes more sense. I was if a doctor tells you to get your blood tested, like who?
No, didn't you not hear me? Elizabeth said she pulled people herself. I'm assuming she was down on the street with a clipboard and a questionnaire form, just filling things out for hours on end.
Have you ever been told to give blood? Did you?
Yes.
I mean, that's just so okay.
I think between the two of us, we get a pretty good ratio of yes, we both have. I don't think these numbers are correct.
That's crazy.
So Dermot V. Shorten is Quest's vice president of strategy and ventures, and he said that number is actually 30%, which is still higher than I thought it was going to be.
Yeah, it makes more sense though.
He said this, citing Quest's own figures. He added, "It is a huge number," and he also said less plausibly, "I don't think we've ever heard that fear of needles was the reason."
I would think the real reason for most people, I'm sure there's some people with needles, but would be fear of, same reason people don't go to doctors, like fear of finding out something or.
Better cost if you don't have insurance.
Right. But I would assume if you're seeing a doctor.
Not necessarily.
Yeah, that's true.
I mean, you're right. It could just, it's probably a combination of reasons.
But it's not half of people, basically.
No.
Yeah.
No. It's a third of people.
I actually prefer a needle too. My grandma used to let me play with her diabetes thing. The things that go like pokes you.
Yeah.
I hate those. I would rather get a needle in my arm than be like.
Yeah, those things are awful. Yeah, my grandpa used to have to do those. Those things are awful.
Yeah.
So it was argued that the fingerstick blood tests aren't reliable for clinical diagnostic tests because the blood isn't drawn from a vein. The sample can be contaminated by lanced capillaries or damaged tissue. And again, that's coming from like Quest. That's like a pretty well-known, like that's why we draw blood the way we draw blood.
Right.
Because it can be contaminated if you're not getting it from the actual vein, like if it's come through the skin in some level. So Holmes strongly disagreed with this, though. She said, we have data that show you can get a perfect correlation between a fingerstick and a venipuncture for every test that we run. When asked for evidence, Daniel P. Edlin, Theranos' senior product manager, sent a document titled Select Data. It purported to show favorable results from numerous comparison tests. When asked if the test had been conducted by an independent third party, he replied by email, the clinical tests were conducted by a combination of Theranos and external labs. But he didn't mention which ones. He never said which ones these independent labs were. So they could have just been other Theranos labs. We don't know. Maybe there weren't any other labs at all.
There's some Walgreens.
Maybe they did it inside a Walgreens. So the company's reluctance to share its results or display its devices prompted wariness among some physicians and medical officials. Lakshaman Ramamurthy, the former associate director at the FDA, was concerned. He said the technology should have peer review. To claim, as Theranos does, that with a fingerstick you can do hundreds of tests, your technology has to be different. He went on to add, does that not need some peer review?
You would think.
You would think most people, and I think most people would answer, yeah, I feel like it probably should. Because this isn't 1830, where you could just say you're a doctor or whatever.
Right, which she basically did.
That's basically what she did. Technically, it doesn't. Quote, typically, laboratories are not required to disclose data on how their tests work, said Alberto Gutierrez, the director of the FDA's Office In Vitro Diagnostics and Radiological Health. The FDA imposes rigorous standards on companies seeking approval to sell new drugs, but most blood tests aren't monitored by the FDA and don't receive the same level of pre-approval scrutiny. The labs are effectively left to police themselves. Which,
That
if
seems
history
like
has
that
told us
should
anything,
change.
that's the way you let all industries run. They will take care of themselves, and they will do what's best for humanity every time.
Yeah, I mean, I know it's not the same as giving someone a drug. So, I mean, I know drugs have to be more
Well,
because you're.
but if you misdiagnose something,
I know that's
you're
what I
going
was
to
just about
cause
ready to
somebody to
say.
get a drug. Oh, okay.
Yeah, get a drug or die.
Mm-hmm.
I mean, if you have high cholesterol and the fake Theranos test is like, you're fine,
Yep. And then you have a heart attack.
Right.
We didn't know. Theranos said he was fine.
Right.
Where's Dad now? He's dead.
Oh my God.
So in 2015, that's when things kind of took a turn, Dennis. That year, the winner of the 2015 George Polk Award for Financial Reporting, John Carreyrou of the Wall Street Journal, started an investigation. I had an investigation going on Theranos, but he finally came public and raised serious doubts about claims by the firm and its celebrated 31-year-old founder, Elizabeth Holmes. And this is the dude that blew the lid off of this case.
Oh, I haven't heard about this.
He wrote a book about it actually called Bad Blood, which is it documents the whole thing. Like, that was part of what I read that was just like, there's too much to put in this episode. Like, he was on this for like years. Like, he started out with like a source that was like 2 or 3 people removed, but was somebody from the company. And so he's just like, I knew that I could. He knew what he needed to work towards. He just kind of had to pull threads until he finally got to like a main source.
Right.
And then he was really able to start tying things together. So I just want to run through just some of the highlights of that investigation that really started blowing the lid off of this. So one former senior employee says Theranos was routinely using the device named the Edison after the prolific inventor for only about 15 tests in December 2014. Some employees were leery about the machine's accuracy, according to the former employee, and emails reviewed by the Wall Street Journal. Theranos also didn't disclose publicly that it actually does the vast majority of its tests with traditional machines bought from companies like Siemens AG.
So just the same as competitor. But how do they do that with less blood?
I don't know that part. That I couldn't figure out how they were doing that.
I did see a video once where they were talking about, I wasn't Kissinger, but it was one of her older, I think it was the former CDC guy.
Mm-hmm.
And they said that every time that she would do tests on him, and he said that like every time they'd always say, oh, something's wrong with the machine, we're fixing it, we have to take more blood, and then they just end up doing like a regular test on him. I wonder
that happened a lot.
Yeah, but I wonder like if I go on a Walgreens and they prick my finger, like, yeah, I don't know.
Well, they send it off to a Theranos lab from there. They don't deal with it.
I know, but you couldn't use that amount of blood in the old machines.
Well, I mean,
or they're just like fabricating results, basically. Like,
that's kind of what I gathered based on, because I had the same kind of thinking. And yeah, I don't really know. They got results back. I don't know really how. I suspect, honestly, and I've always kind of thought this, and again, I'm not a doctor or anything, but when I've gotten blood drawn, I'm like, you don't really need that much. Like, this is, I feel like there's a lot of slippage that's like added into like the blood removal. Like, we're going to spill like 2 of these accidentally, so we need 3. And then we only need like a 4th of that one actually to do all the tests.
That's hilarious.
Because I've had blood drawn where I've like my doctor's call me and be like, hey, we need to draw more blood to run additional tests. And then they call me back and they're like, no, actually we had enough. We're good. So there is some room there for playing with.
There's some wiggle room.
Mm-hmm. Mm-hmm. And ever since then, I'm like, you guys don't need all that blood, do you? You guys don't need all that blood, do you?
Like I said earlier, it's a lot. I forgot how much it was.
I've noticed though, like most of the time when I've gotten blood drawn, whether they're running like 1 test or 10 tests, it's like the same amount of blood they draw.
Yeah, they always take like 4, like 3 or 4. Yeah.
So I think maybe that's what I think. Maybe we think they need way more than they actually do, and that's how she was kind of getting away. Maybe she could stretch it out a lot farther than we thought.
Yeah, maybe.
Either way, she is using other labs' equipment though, or other companies' equipment to do all this. So Holmes declined interview requests from the Wall Street Journal for more than 5 months. And in October 2015, the company said she would be available to comment, but her schedule didn't allow it before publication of the article. So she didn't get to say anything on it.
How convenient.
Yeah.
It's because she wanted to know what they had.
Yeah, I think that's more what
it's like any con artist. She needed to see the article. That way she'd know what to say.
Yep.
Because she might lie about something he already figured out was a lie.
Yep. I think you nailed it right there. I think that's exactly why she was unavailable. So, whether labs buy in their test instruments or develop them internally, all are required to prove to the Federal Center for Medicare and Medicaid Services that they can produce accurate results. The process is known as proficiency testing and is administered by accredited organizations that send samples to labs several times a year. Labs must test those samples and report back the results, which aren't disclosed to the public. If a lab's results are close to the average of those in the peer group, the lab receives a passing grade. So in early 2014, Theranos split some of the proficiency testing samples it got into two pieces. According to internal emails reviewed by the journal, one was tested with Edison machines and the others with instruments from other companies. Again, it appears that they don't really need nearly as much blood as they take, because she's splitting these samples. Right. But I'm not sure, with it being Medicare, Medicaid, they're probably sending her a normal amount of blood, though.
I would assume so, yeah.
Actually, now that I think about that, yeah, they're going to send the same thing to every company. So yeah, that's how. So she's able to split there. So there's enough there that they at least have twice as much as is actually necessary, I think, is what we can gather from this. When they draw blood, they needed half as much as they took from you. So the two types of equipment gave different results when testing for vitamin D. Again, her equipment that is the Edison machine, and then like Simmons AG testing machines. And this is all coming from employees. The two types of equipment gave different results when testing for vitamin D. 2 thyroid hormones and prostate cancer.
Sheesh.
Yeah, imagine having prostate cancer and trusting one of these machines and then not finding out. That's where this was headed.
Right.
The gap suggested to some employees that the Edison results were off. According to the internal emails and people familiar with the findings, senior lab employees showed both sets of results to Sunny Balwani, Theranos' president and chief operating officer, and I believe at this point, dating Elizabeth. In an email, one employee said he had read through the regulatory more finely and asked which blood results should be reported back to the test administrators and the government. Mr. Balwani replied the next day, copying in Ms. Holmes, quote, I am extremely irritated and frustrated by folks with no legal background taking legal positions and interpretations on these matters. Also, this must stop.
Oh, this is where the fraud comes in, or the...
You're getting it. You're getting it, buddy. This is where things really just start. Again, she has over 700 employees that all have to keep this story going, basically.
Right.
Like, that's the part with con artists that always confuses me, is when they get a whole bunch of people that don't know what's going on involved and they just expect everything to keep on working.
Right.
I'm like, they don't all know your lie, man. You know that, right? Like, they don't know what you're working here, and most of them are probably going to feel guilty about what they're doing if they are being deceitful.
Exactly.
So he added, after he said this must stop, that samples should have never actually been run on Edison's to begin with. Why are you guys even using our machines to do this? This isn't an email, Dennis. This isn't an email.
Proof
that, like, once technology hit, it got a lot harder to become a con artist. Like, once you had like emails and stuff, like where you were writing stuff down.
Exactly.
You sign like from an address. Again, that always baffles me when I hear about people that like are this deep into something like this, because he knew. Obviously, he knew.
Well, yeah, I mean that's why he's saying this. So I mean, at a certain point, though, they know it's only a matter of time, right? Or that they have, so you just have to keep it going.
Yeah. Former employees said Mr. Balwani ordered lab personnel to stop using Edison machines on any of the proficiency testing samples and report only the results from instruments bought from other companies. And you're right, this is pretty much where we get into fraud. Pretty much. The former employees say that they did what they were told, but were concerned that the instructions violated federal rules, which state that a lab must handle proficiency testing samples in the same manner as it tests patient specimens, and by using the laboratory's routine methods.
Well. Well, yeah, you're trying to test if the freaking technology works. I mean, oh my gosh.
We're trying to spin a several billion-dollar lie, though, Dennis. Like,
I feel so bad for anyone who got one of these things and got sick or something.
I know, right? Well, I mean, I guess they weren't here. If you were in California or Arizona, there's a good chance you did.
Right.
With this. So under pressure from regulators, Theranos stopped collecting tiny vials of blood drawn from fingerprints for all but one of its tests. So now we're down to one test that we're going to say this machine can do. The Edison machine has gone from hundreds to 19 to 1. Fortune magazine wrote about Holmes again. Remember, they were all glowing about her not too long ago. They wrote about her again in 2015. According to Fortune, Theranos filed new paperwork in Delaware just days before that explosive Wall Street Journal article hit in October. They published this a month after. Theranos board of directors approved a Series C3 stock authorization filing in September 2015. So right before the Wall Street Journal comes out, they're trying to sell more stock. Shares were not necessarily issued or sold. For example, other filings show that Theranos authorized the sale of 11.7 million Sector C2 shares at $17 apiece back in February of 2014. But it then increased the amount in January 2015 to a whopping 58.8 million shares at the same price of $17 per share. But shortly thereafter, Theranos said in a different filing that it only had issued a total of 32.2 million shares of authorized Series C2 stock, which I could get in really weird economically about what's going on there, but it's not worth it. They're doing some weird stuff, though. Are
they lying, or are they cashing out, or what? Like, basically what
I think they're trying to figure out what they can get away with as far as further funding, possibly.
Right.
So, the Wall Street Journal's initial report alleged that Theranos was struggling to make its revolutionary in-house technology actually work, and reports that only about 10% of Theranos' blood tests use its technology, with the rest of the tests being carried out using traditional blood testing tech. Even the company's own employees had concern about Theranos' blood tests, as I'd said. Then in October 2015, right around the same time the article's coming out, the FDA released some heavily redacted notes from a visit it took to Theranos' lab. And I looked at them. I didn't really include them. They are so redacted. It's going to be in the show notes. But there's a document. It's got a whole bunch of black bars through it. It's so many black bars. It's like, we were here, blank, 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 blank. And like I said, they don't look great. Investigators essentially concluded that their visit wasn't strong enough evidence that Theranos' device was doing what it was supposed to do. So now the FDA is finally, 12 years later, the FDA is like, I think something might be funny here, you guys. We should probably come check it out. Something is weird here.
Sheesh, man.
But she's super connected, so all of it gets that's the only thing I think, and I'm speculating there, but it is kind of curious that she has all these powerful men on her board, and this report gets heavily redacted on anything that would really be
damaging
evidence.
Yeah.
So, like I said, investigators essentially concluded that there wasn't strong evidence the devices were doing what they were supposed to do. Founder and CEO Elizabeth Holmes had also recently announced she'd share the company's data by opening up to peer review, but didn't reveal when that would happen. Look, we're going to let them.
It's coming. It's coming.
You guys worry about it. It's like, and this is the part in all cons, whenever you watch American Greed or anything about a con artist, where it's like, oh man, you know it's over now. Like, why aren't you leaving the country? Like,
right. Delusion.
It's the weird thing about they just stay on that sinking ship. I'm like, why wouldn't you like disappear to somewhere without an extradition treaty?
Part of them probably wants to get caught. I'm sure it's exhausting. I mean, you have, what do they have, like 700 employees? You're probably lying to most of them. You're lying to your board. You're lying to the world. You're like hoping that something works out. Like, it's just got to be, part of you has to just be like, make this end.
I think you're right. I think that's exactly what it is. Yeah, it would be exhausting. And at a certain point, it's like, well, this didn't work out, but I've got to continue to ride this out because I can't just be like,
Right.
look, I
Here's
had
all
high
your
hopes for this, but sorry, guys.
Now, do you know if she continued to try to like fix the Edison machine? Like, was she like pouring money into like making a better one, or was it just like we're gonna roll with this machine?
It's unclear because at this point, she is living like a baller. Like she has a big mansion, like she's traveling, like living a very extravagant lifestyle. So I think at a certain point, yeah, she's cashing in almost.
Right. Enjoy it while it lasts.
I meant to include pictures of. So she went from that 2-bedroom house that I talked, or a condo that I talked about earlier, to a massive estate, just huge. Like it was a complex, like crazy gate, just the whole
So
thing.
she knew what she was doing then.
Yeah. I think by the end it was just like, well, I'm going to live the best life possible for these last few years, or however long I can keep these plates spinning.
Right.
So since that report came out, the one by the Wall Street Journal, Theranos defended itself on stage. Get this, Dennis, at the Wall Street Journal's WSJD live conference in 2015.
Awkward.
Yep. They did more through a report on their website, but the 31-year-old, she'd been scheduled as a guest speaker long before the same newspaper hosting the event published that brutal expose of the secretive blood testing startup. The journal alleged in deep detail that Theranos Diagnostics technology wasn't performing as promised. And she still showed up. That was the best. I mean, I guess what else do you do?
Yeah, you can't hide.
Yeah, because then I guess you definitely show you're guilty if you don't show up. So Holmes gave interviews after the story appeared, and pushed back against its claims. But that's not the same thing as showing up in the heart of enemy territory. But she did. Needless to say, things were a little awkward. She went on to say, while she's on stage, I read what was written in that article. We disagree with it. We think it was false. And we think it was misleading.
There's nothing. It's too late now, man. You can't start telling the truth now. Of course, it's never too late.
You're right. I mean, yeah, what choice do you have? You got to keep this lie going now. So in that instance, Holmes was specifically referred to a journal report that the FDA inspector recently showed up unannounced at Theranos over concerns about data it had submitted to the agency. Because again, they had the proficiency test and they thought they were weird, so they showed up, and then they redacted that report heavily. But the quotes could stand for Holmes' assessment of the journal's reporting in general. She said the journal's claim Theranos was using its proprietary Edison technology to run just 15 of more than 200 tests it offers was irrelevant, because Edison was a company code name for old tech it doesn't actually use anymore.
Oh, okay. Wow.
I mean, she's got a spin on it. You weren't expecting her to have an answer for that one, were you?
No, we call it Edison because it's old. Okay.
Yeah, that's the old one, man. We got a new one now. Yeah.
It's the same thing everyone else uses.
Yeah. We found out that's the best way, actually.
I mean, like, theoretically, she could have got out of this if when they realized it wasn't working, they just said, okay, we're going to use the old machine. I mean, I'm sure the company wouldn't be worth much, but they had a ton of funding and, like, they had all these partnerships with, like, Walgreens and the military. Like, I guess.
It could have become just a Quest Diagnostics or whatever and already been embedded in Walgreens. Of course, would Walgreens have kept the contract for something that wasn't any better?
That you had to take 4 vials of blood for?
Yeah, it's debatable. Probably not. She said that the journal failed to provide the proper context for the way it tests the proficiency of its fingerstick blood tests. And she said that the journal misrepresented the issues around the fact that it uses blood drawn from finger pricks. The method at the heart of Theranos' promise to put an end to the painful practice of drawing vials of blood through patients' veins for just one of its tests. Again, we're down to 1 with the pinprick.
Right.
In its piece, the journal said Theranos had dialed back its finger prick testing under pressure from regulators. Holmes said the company was merely taking a hiatus as it made a voluntary switch to a more rigorous approval process. And you're going to love this quote, Dennis. This is how she described it on stage at this conference. Quote, "If you have cars driving on a road, and I'm going to take everybody from driving on the right side of the road to the left side of the road, the only way to do that is to pause." So if we're going to upend this whole this blood test game, we just got to stop for a second and be like, whoa, guys, look, we're changing the game.
If she was truthful, like if they had a like Edison 2.0 or something, like fine. It just always amazes me, like how people just can't give it up. Like,
yeah.
Yeah.
In addition to defending her company, which was again valued at $9 billion on more than $400 million in funding, Holmes went on the offensive against the journal's sources. Of 4 former employees cited by the journal anonymously, Holmes, which I don't know how she claimed this because they're anonymous. I guess she thinks she figured it out.
Yeah.
Holmes claimed that one had worked at the company for only 2 months in 2005, and, quote, "the others are clearly very confused. They just don't get it. They don't know what's going on here."
Gaslighting.
Yeah, that's exactly what it is. She also assailed the journal for quoting the widow of a Theranos researcher whom the newspaper said committed suicide in 2013 after reportedly telling his wife that the company's technology wasn't working.
Oh, that's awful.
And she went after them. She said, quote, "I've never seen the Wall Street Journal as a tabloid magazine." And to quote a widow, is just really going in an inappropriate area.
She's doing what every liar does when they start to get caught. She's like putting it back on the person who figured out the truth. Like, I mean, we've all experienced this from somebody in our lives, and it's just,
oh yeah,
it's so transparent.
So for the length of her onstage appearance, again, she's still at this conference that the Wall Street Journal is holding, which is the company, the paper that exposed her and all of this. She was on stage for 30 minutes, Dennis. Can you imagine being up there for this for 30 minutes?
Yeah, I'm guessing a lot of that was a Q&A.
Yeah, but it felt like an eternity, I'm sure.
Oh, God,
man.
I'm sure.
Talk about a rough room, man. So Holmes was unwavering in her defense of her company and her criticism of the journal. Attendees at least came away feeling like she still didn't address the more fundamental concern, which isn't just the company's science, but how Theranos has played into the Silicon Valley myth-making machine to give the impression that its technology is more advanced than it is. Science moves slowly. Silicon Valley moves fast and breaks things. Theranos has tried to have it both ways, which makes it not entirely surprising that the company found itself on the defensive. So Holmes went on to say, "What we know are the facts of what we've done, and we know the integrity of what we've done." Which is,
I know I'm not lying.
Look, I know I am lying, and I know we've done nothing, but I'm not going to tell you that right now. Now, Theranos just had to convince everyone else. Holmes went on to appear on Mad Money with Jim Cramer and other media outlets to do damage control. She was shocked by the Wall Street Journal's article and claimed that Theranos supplied over 1,000 pages of documentation to refute the allegations. The Wall Street Journal stood by its reporting.
Yeah, I don't think of the Wall Street Journal as, I think of it as one of the better, I mean, I know that I don't trust a lot of media, but the Wall Street Journal is usually pretty down the middle. I don't know why they'd be slandering your blood testing company just for the heck of it. Like,
it's a very...
Isn't it? Wait, hold on. Isn't the Wall Street Journal owned by Rupert Murdoch?
Yes. Again, he had invested $100 million in this company at one point.
He probably called up that reporter and was like, "I need you to do some work."
You know what? I bet, but yeah, because he left. He left at one point, so yeah.
He's probably like, "Did I just give $100 million to a con man?" Like,
you know what? I wonder if that's Scott's.
It's like his revenge.
Kind of, because he got out in 2016, I think I said. So this is before that. So he's still in it at this point, which is even weirder. Like, his own paper is like outing her, and he's still like involved.
Right.
So, just to I'm just going to speed up the timeline a little bit because that is really where things melt down at, or the turning point, the tipping point, whatever you want to call it. January 27th, the following year, 2016, the Centers for Medicare and Medicaid Services, CMS, released its very negative report on Theranos' California-based lab, which basically just points out all the stuff we've been talking about. Like, yeah, they ain't really doing any of this stuff, and I think they're using other people's equipment. Like, I think this might be bad, you guys. Like, I don't know that we're on board with this anymore. January 28th, the next day, following the CMS report, Walgreens Boot Alliance, which is the company that owns Walgreens, decided to temporarily close the Theranos Wellness Center in Palo Alto store, in its Palo Alto store, and suspend its use of the Theranos Newark, California lab. And this is where lawsuits just kind of start flying at us. Like, there's several of them. May 1st, 2017, Theranos settled a lawsuit with Partner Fund Management, one of its largest investors, after the hedge fund accused the company of securities fraud. Theranos had previously settled with the Center for Medicare and Medicaid Services and the Arizona Attorney General. Just there, like, and I couldn't find a lot of information, and you would know as an attorney, like, they kept this hush-hush. Like, they paid people outside of court.
Oh, you'll never see those settlement agreements.
Yeah, that's what I mean. I couldn't find anything really on what was going on with that, other than lawsuits got filed, lawsuits went away.
Right.
So more litigation happens, and again, a lot of these settled out of court, so that not a ton of info. A year later, March 2018, March 14th, 2018, the SEC finally charges Theranos, its founder and CEO, Elizabeth Holmes, and its former president, Ramesh Sunny Balwani, with massive fraud. June 15th, 2018, a federal grand jury indicts both Holmes and Balwani on 9 counts of wire fraud and 2 counts of conspiracy to commit wire fraud.
What did they do? Do you know what they did with the wire fraud? Or is it just probably their security fraud and all that?
Yeah, well, we're going to get to it. This isn't over. Like, to this day, this isn't over.
Oh, I know. Yeah, I'm sure. If they were just doing this in 2018, that stuff moves so slow.
Yeah. So the press release from the U.S. Attorney's Office stated that in order to promote Theranos, both Holmes and Balwani engaged in a multi-million-dollar scheme to defraud investors and a separate scheme to defraud doctors and patients. And I don't know how that rolls into wire fraud exactly. I think that has to do with the way they're moving the money around. Possibly, I think that's what wire fraud is.
I'm sure. Well, I'm sure.
The trials, okay, so Holmes had stepped down as Theranos CEO earlier that day. So in June 2018, she steps down, but she continued to be the chair of the company's board. The trial continued to get pushed out, but so the trial keeps on getting pushed out, and it's finally was set to begin in July of this year, 2021. In September of 2020, a court document revealed that Holmes may seek a mental disease defense at trial.
That's probably all she got, man. And she probably is some sort of like sociopath. But you see, the thing is, though, you can't be like, I'm crazy, because like a crazy person couldn't orchestrate, not, if you had some sort of like delusional disorder or something, which I just heard about yesterday. I just learned about yesterday. It was really weird. You couldn't do all the lying.
Yeah.
You wouldn't have the state of mind to be like, use that machine instead of our machine. You'd just be like, of course our machine works.
Yeah.
So, oh man.
So flash forward now. Okay. So March of this year, according to a filing made with the U.S. District Court for the Northern District of California, Holmes' counsel advised the U.S. government on March 2nd that Holmes is pregnant with the due date of July 2021.
She timed that right.
I know, right? I'm like, so you were like, I guess she knew when the trial was going to, so she was trying really hard to have a baby in like November of last year.
Yeah. Her and Sonny.
Having a COVID baby. I didn't even look into who the father was. I kind of wondered.
Oh, yeah.
She's not married. I don't know if she's still with Sonny or not. Like, I didn't really get too bogged down in their relationship.
That'd be a really desperate Tinder profile. I am on trial for securities fraud, and I need to have a baby in November.
I know, right? Like, you would really have to plan that out just right. So the parties have met. Okay, so the parties have met and conferred, and both parties agree that in light of this development, it is not feasible to begin the trial on July 13th, 2021, as currently scheduled, read the filing. In light of the defendant's pregnancy, the parties stipulate and agree and respectfully request that the court order the trial to begin jury selection on August 31st, 2021.
Oh, that's not that bad.
No.
Just a month.
Balwani's trial is slated for January 2022, although I heard he might be pregnant as well.
Okay.
Federal prosecutors will be allowed to highlight Theranos' founder, Elizabeth Holmes' taste for globe-trotting and celebrity in her upcoming fraud trial. A judge actually ruled this after her attorneys argued that such details could inflame jurors' class prejudice. Like, they want to make the argument like, look, for the last few years, like, she knew she was going down. Like, look at these trips she's taking. Look at these, like, nice things that she's buying. Like, she's burning money as quick as she can.
Yeah.
So Holmes' glamorous lifestyle included traveling by private jet, driving an expensive SUV, and staying in pricey hotels while hobnobbing with influential friends and backers. U.S. prosecutors in Holmes' upcoming trial argued that the disgraced businesswoman's lavish lifestyle and its relationship with powerful people incentivized her to commit fraud. Judge Edward Diwali, who was overseeing the case, threaded the needle between the prosecution and defense by determining that information about Holmes' travel, salary, and taste for celebrity are admissible evidence, but the details on other aspects of her lifestyle are not. He said, the government may introduce evidence that Holmes enjoyed a lifestyle as Theranos' CEO that is comparable to those of other tech company CEOs. This includes salary, travel, celebrity, and other perks and benefits common with the position. Davila wrote in a court document filed in March in the United States District Court for the Northern District of California. He went on to say, however, reference to specific purchases or details reflecting branding of clothing, hotels, or other personal items is not relevant, and the prejudicial effect of that evidence outweighs any probative value.
Yep.
And that's pretty much where we're at with it at this point. Like, I don't know. I mean, I don't think I mentioned this. They are facing each up to 20 years in prison.
It'll be an interesting trial. I hope Court TV shows it. They've been showing a lot of that Robert Durst stuff lately. Mm-hmm. Yeah, I would love to see the Elizabeth Holmes trial.
And there's some good documentaries and stuff out, like, just about her and, like, this whole debacle. Like, there's a lot of information about this out there. But yeah, oh boy.
Wow, Hamburger, good research, man. That was pretty. I feel like I just know everything about this woman.
There's so much more, though. I didn't even include half of the things. Like there was a lot. Like, her backstory was. I found so much. I do like stories like this, much like the Karen Silkwood, because there's just so much verifiable information out there about the different players and everything.
Yeah, this is really interesting. So she went from being super wealthy to in a jail cell. Is she in jail right now, or
no? I think she's out right now.
Okay.
Yeah, she's pregnant and everything.
That's gonna be interesting if she says she was, like, mentally unstable. Oh, I'm sure she probably was to some degree. Well, but not in the way that gets you off from a crime. I mean, most people who can have some kind of personality disorder or something. But, like, man, I wonder if she'll use her fake voice at trial. She probably won't testify.
Probably not. I wouldn't think so. I don't know, man. With her demeanor and the way she's gotten through life, she may feel. I'm assuming her counsel will stop her from doing it, but I bet she wants to.
Oh, I'm sure she probably thinks she can talk her way out of it.
I will say this because I wondered this. So one last little note I have is, like, I wondered, like, okay, so what happened? She had $4.5 billion of this company. What happened? According to Forbes, by June 2016, Elizabeth Holmes' net worth dropped from $4.5 billion to nothing.
Oh yeah, it was all tied up in their
Gone.
lie. Yeah.
Well, I'm assuming with all this litigation that happened at the end, with
I'm sure that didn't help.
litigation where those cases just got dismissed or whatever, got settled outside of court. I'm assuming quite a bit of that money went to pay for that.
Yeah, I'm sure. She should have sold all her stock earlier. Although that would be like
Well, yeah,
show that she was guilty.
Mm-hmm.
She, oh man, what a ride. I'm going to be interested to see what happens in the trial. So I'm glad we're doing this now because that's coming up. It's a couple months from now.
I mean, she is our age.
Basically, her stock dropped to nothing. Right,
she's a little bit older than you and me.
Yep,
she'd be like mid to late 30s at this point.
Well, she was born in '84, I think you said. Or she was 9 when she was 1993. I was trying to figure it out earlier, but yeah, so she's our age pretty much.
Like a year older than us.
Yeah,
we really fell short on this. We could have done so much more in life by now.
I know. We still have a couple years before we're living.
We could probably defraud some people still, don't you think?
Yeah, I mean, we just need we need to figure out what our scam is, and shoot, she got all that money pretty fast.
Mm-hmm. Well, is your dad or mom in the government and a high ranking?
No,
mine either.
One of my aunts is a mayor.
That might help.
Yeah, we could get her involved.
Well, I hope this was a little bit more fun of an episode for you and everybody listening. I mean, I enjoy everything that we do on the show, but I know some of them are more like heavier than others as far as like, oh man, that exists in the world. Like, at least this is one where like justice is being served.
Yeah, it has a good ending.
Well, we'll see. I mean, honestly, I would be surprised if they don't spend time in jail. Like a significant amount of time in jail.
Oh yeah. Or I mean, I don't know. She's pretty rich though. Well, she was.
Not anymore.
Yeah, we'll see.
I mean, it depends on how far her powerful friends can take. How many of those friends she still has. How many of them knew what was happening?
I mean, they're totally going to portray her as like she really was trying to make it work, but she got in over her head, and maybe they'll try to pin it on Sonny.
Ooh, yeah. I would assume, based on numbers just off the top of my head, he's mid-50s at this point, probably. Early mid-50s.
Yeah, or 60s. I don't remember. He was 43 when she got out of high school.
Yeah.
I think you said, but I don't remember. But yeah,
he was in his 40s when he was coming to do the study here. When he was coming to work on the MBA at Berkeley and stuff, I believe.
That's right. Well, yeah, man. Yeah, I'm happy to learn about this, like, with the trial coming up. I'll probably watch some of that. I love watching stuff like that.
I think this one will be interesting because, I am very curious. Does she do the voice? I guess you're right, though. She probably won't talk, but she'll get interviewed on the way. She'll say something to somebody, like a reporter or something coming in and out of the court.
They're not going to let her talk to a reporter.
Well, but like how Cosby did the hey as he was coming. Like, she'll do something. I just need a sound bite. Like, let's hear if you use the voice.
I forgot about Cosby doing that.
That was the weirdest thing.
He had to have a break from reality in the middle of that trial. Man, imagine being him and then you're like, this is your entire gosh, he still thinks he's gonna get out.
Oh, I know. He definitely thinks that.
Yeah, but yeah, maybe she'll do a hey.
I hope so. That would be. She got the voice for it.
What a weird thing to do. I forgot about that.
But this is, I really liked researching this one. This is, like I said, it was a lot of fun to put together just because there's so much information out there. Like it's all very verifiable. Yeah,
this was a neat little something different than what we normally do. So
yeah, I hope everybody enjoyed it. I plan to do more corporate conspiracy type things. I know there's more stories like this out there for sure. The Standard Oils and the Enrons, and there's some weird stuff out there.
Yeah, it's stuff you hear about in the news, but it's like getting into the details. It looks like it's pretty rare.
Just how messed up it really was.
Yeah, for real.
So, thank you all so much for listening. Thank you, Dennis, for being here. Like, rate, subscribe. Send the episode if you liked it. Share it with a friend. We appreciate all that, and we'll be back next week with more Cryptic Counts. Thank you, everybody.
Goodbye.
Bye, Dennis. Love you.